So, hello everyone. So, this is Nitika here from Little Amigo Nest, and today we have Dr. Riya Dedhia with us. So, Riya Dedhia is a pediatric nutritionist and clinical dietitian. She has done a BSc in food nutrition and dietetics, and she is a rank holder. She's also done an MSc in specialized dietetics, and her specialization is pediatric nutrition. She's also a rank holder in that. So, welcome so much, Riya Dedhia. And Riya is a certified diabetes educator. She has received KU Naram Award twice for ranking second in BSc and MSc. And she has worked in Hyderabad in Fernandez Maternity Hospital. She has worked in Mumbai at INS Hamla and Tata Memorial Cancer Hospital. She's also been a visiting professor at SNDT University, Juhu, and she's also a chapter author of the book Clinical Nutrition in Cancer Practical Guidelines and Dietary Recommendations 2022. Currently, she's practicing in Mumbai, in Matunga and Mulund at a clinic. So, welcome, Riya. It's really lovely to have you here, and we have a lot of questions which we would like to ask because, as you know, I'm the founder of littleamigonest.com. So littleamigonest.com is an e-commerce platform which is like a one-stop shop for all the children's needs. And we have a lot of young mummies and daddies who are there, and they are, the ones who have lots of questions for young children regarding the nutrition of children. So today I would be asking a few of those to you. So are we ready?
Yes, yes. Thank you for having me and excited to have this conversation with you.
Yeah, Riya, we really look forward to. So nutrition is a topic which is, very, very close to everybody's heart, and everybody wants their children to eat a healthy diet. So I have a few myths here which are related to the nutrition for young children, and I'll be asking those, and let's see how you bust them. Okay.
Sure.
So the first one, which is there, is that children need to eat everything on their plate. So how true is this? Is it a myth, or is it a reality? What do you have to say?
So it's definitely important to foster healthy eating habits rather than enforcing strict rules. So definitely Indian moms, have a good intention in feeding their children, definitely. But forcing kids to eat everything on the plate can lead to negative feelings about mealtime, like overeating or unhealthy attitude towards food. And researchers have shown that children who do better when they can listen to their own hunger and fullness cues. So it's very important to develop a natural and a balanced approach of eating, and creating a positive mealtime environment and promoting a balanced eating is actually more effective than actually just making them finish the plate. So definitely this is a myth, and more important is having a balanced diet where children themselves are more inclined towards consuming that meal.
Very true. Balanced diet is very, very important. And thank you for highlighting that, doctor. So the next, sentence for you, you will have to tell me whether this is a myth or this is a reality, is that sugar causes hyperactivity in children. So what's your take on that?
Very interesting actually to know this. So the idea that sugar causes hyperactivity in children is so popular, but it is strongly backed by research that sugar actually doesn't cause hyperactivity. Instead, what often happens is when children consume this high sugary foods or processed foods or carbs, especially coming from sugar or fast foods, are consumed especially during exciting events like parties, some kind of celebration where kids are already more energetic. So parents usually relate them to hyperactivity. That's one scenario. Second thing is higher intake of sugary and processed food is a concern, definitely for other reasons. Where you consume high sugar, there is more sugar spikes, and that could lead to imbalance of insulin levels, and that changes the mood and energy of the children. Additionally, if children eat too many of these foods, they might miss on the balanced diet that includes important nutrients like omega-3 fatty acids or zinc or magnesium or even iron. So actually deficiency of these nutrients could lead to some kind of issues with related to your brain, or there could be lack of behavioral problems including hyperactivity. So in summary, while sugar itself may not directly cause hyperactivity, but a diet which is high in processed sugar can cause nutritional deficiencies that contributes to hyperactivity issues.
Okay, that's really, really very interesting because, children love eating sugary things, be it
Correct.
candies, toffees, or even the sugar in the hidden form, that is, which is there in the bread, even in the ketchup. And children do consume a lot of fast food items these days. So that's really, really very interesting. So thank you for, advising us on that. So now another myth coming your way. Fat is bad for children. What do you say? Because every mother in Indian homes will put a dollop of ghee or a butter and feed the children. So, how good or how bad the fat is? Please tell us.
So before breaking this myth, let me explain you that there are two types of fat. First is saturated fats, that's mainly found in ghee, butter, processed foods, meats, red meat. And the second is unsaturated fats that mainly comes from nuts, seeds, olive oil, avocado. So the saturated fats is the good fat, and the unsaturated fats, the saturated fats is actually not good for health, and the unsaturated fats are beneficial. So the idea that fat is bad for kids is a myth. Why? Because fats are an essential nutrient for children's growth, brain development, and hormonal production. So instead of cutting down fats, parents should actually focus on providing healthy fats from sources like nuts, seeds, avocado, and limit unhealthy saturated and trans fats, mainly coming from packaged products and fried foods. So, a balanced diet with the right type of fat supports overall health and development. So, definitely, it's a myth that fat is bad for kids.
So this definitely helps because, as I said, Indian moms, grandmoms are very, very fond of ghee and butter, and everybody advises, that you can have as much as you. It's only children; they're going to grow up. So that's really, really, really nice to know about it. Now, another myth for you: juice is a healthy choice. So, what do you have to say about this?
So, this is the most talked topic, and I think every, not even parent, but even adults have this myth that अगर fruit नहीं खा सकते तो एक glass juice पी लेते हैं, at least you get the nutritional benefits of the fruit. But let me explain this with an example. So, for example, if you're having a glass of orange juice, mostly 4 to 5 oranges would take to make one glass of orange juice, right? And you complete that juice maybe in less than a minute. Rather, if I ask you to have that 4 oranges, you will minimum take 15 minutes to complete, right? So, understand how much nutrients or how much portion of the fruit you are actually missing while having that juice. So this breaks the myth that consuming juice, even if it is a homemade juice, is a completely no, because you are just having pure one glass of sugar and you are avoiding fiber, vitamins, minerals. And because of consuming a fresh glass of sugar, you are actually increasing your sugar spike, which leads to insulin resistance, diabetes, early onset of heart diseases, or even fatty liver. So, understanding that moderation is the key, and always consume whole fruit instead of juice for the maximum benefits. And the myth we break here is juice is not a healthy choice anytime, not even for children and for adults.
Yeah, thank you so much for busting that myth because this is really true. And the example which you gave was really nice. I mean, I can also understand eating 4 oranges versus gulping down a glass of juice and definitely cutting out on fibers and so many other things. So, yeah, that's really, really true. Okay, another thing which is again very, very close to all young mothers, children are very, very picky eaters. Most children are. And they are advised by grandmoms or visiting relatives or friends that picky eating is just a phase. So what do you have to say for this? Is picky eating just a phase?
If I talk back a decade back, picky eating is very normal. Like every children who grows, because when you introduce any food to a child, definitely it's going to take time for the child to develop the taste, texture, consistency of the food, which is normal. But these days, picky eating is actually influenced by multiple factors, which includes genetic, psychological, neurodevelopmental reasons. But I would like to highlight the most influential factor, which is parental influence and feeding practices. So, giving you a small example, that usually children tend to avoid a particular food basis their parents' likes and dislike, which is very common. Like if a parent doesn't eat, for example, fruits, children are more likely to not eat fruit. So very important to understand that picky eater sometimes can just be a developmental change, which might go away with the child, growing and maturing. But if this continues, then it is something to be addressed. Why? Because the influence you have it at home, the environmental factors are very important. Like how you're feeding the child, what is the environment you're creating while feeding the child, are you eating the same food as the child? For example, a mother always asks a child or a parent asks a child to eat maybe few nuts, but parents themselves are not eating that, right? So influence is very important. So picky eating is not just a phase, but it has to be uh, highlighted, and it has to be addressed rightly and at an early age. That's very important.
That's very, very important what you have highlighted, because in most homes it is like, treated as just a phase. They'll grow up, they'll understand how important food is for them, and they'll start eating. So definitely this is
Also,
another.
here I would like to highlight that we are exposed to so much technology these days that also influences the child's eating habits. Like if child is watching a TV or a mobile phone while eating, it influences their eating habits. Also, if you're taking the child to some restaurant or some eating outlet, that as well influences the child's eating habits. So very important is the first 5 years. However you shape the child in the first 5 years, they're going to mold in the particular way in their adulthood.
That's very true for early childhood education, even for brain development. Now, even National Policy of Education has highlighted that the first 6 years of a child's life are very, very crucial. So, yes, first early years are very, very important. So, it's very important for parents to pay attention to the child's nutrition. Now, I would like to move on to something else. I would now like you to share your wisdom with us and tell us what we should not do when it comes to children in terms of nutrition. So, if you could give us, 3 or 4 points which are very, very crucial, which any young parent should not be doing when it concerns the child's food. So, could you please share some?
So just summarizing this 5 key points to keep it in mind for a positive child nutrition. First is avoiding using food as a reward or a punishment for your child's eating habits. Second, don't compare your child to others. Third could be staying positive with language, with the words that you're using around food or around eating habits with your child. And don't use restrictive diets, or don't compare, food as good or bad. Rather, put it as food being balanced or unbalanced. So, if these 5 points are taken into consideration, most of the problems would be solved in the early ages of the child's development and growth.
I think that's very, very important, because comparing is very, very common at the dining table. See, your sister is eating so much, or your friends eat much more than you, and that comparison continues. So I think that is very, very ingrained in in the Indian society. But you've highlighted that very well.
Common, especially when your child is going to some kind of a classes. It could be some sport or some drawing or some preschool, where mothers are really waiting outside for the child to come out, and the usual topic of discussion is मेरा बेटा ये नहीं खाता है, इसको फोर्स करना पड़ता है खाने के लिए, I need to give this to them. These kind of a conversation is, even if the child is not listening, but those energies, those vibrations do come to them. and it does affect their mental and neurological development.
One last thing I would like to ask, in fact, from you. As you know, early childhood is an age group of maximum development in children. How can we, make the same food more nutritionally, should I say, enhance the nutritive quality of the same food? Like I remember my mother always used to say, put a little peanuts, add peanut
Mhm.
powder. So those kind of traditional wisdom is also there. So if you could highlight and share a few tips for young mothers that without doing much, if they could add on a few things into the same food which they are cooking, which makes it more important, more nutritious for the young children. So if you could just share a few with your wisdom, please do.
Very easy tip which I usually share with parents during counseling is you always understand if you're giving a wholesome food with your eyes, because you're going to look at the food. So the plate, if it looks colorful, means that you're giving variety and rainbow of nutrients. So make sure that the plate has minimum 4 or more colors. So that is very easy for you to add on the nourishment. That's first thing. Second thing, just understand if the plate has different variety of fruits from different food groups. For example, you add something from the food groups of grains and cereals, then from pulses and lentils. The third is from your nuts and seeds. Then it's from your vegetable source and good quality of fat. So if there are basic 5 food groups, and if you take at least one from each food group on your plate with good colors, it's always going to enhance the nutritional quantity, or the nutritional, what do I say, the nutritional content of that particular plate. It's very attractive as well for the children to eat, because colors usually attract them, and variety of nutrients is going to give variety of nourishment to the body. So a simple example of an Indian thali, if I may give you for the child, is if you are keeping a roti, maybe there could be a colorful vegetable at the side. It could have at least minimum 3 different colors of vegetables. Then there could be a portion of lentil or dal. Then at the side there could be some certain seeds, for example till, or some groundnuts, what you already mentioned, or it could be some sunflower seeds at the side. So this actually completes a wholesome meal. It's very attractive as well, and a balanced diet.
That's very, very interesting. Also, since you are a dietitianist, you are a dietitian and a nutritionist. So, what do you suggest? What should be a scenario when some scenarios when a parent should refer or come to you? Because see, everybody will think when they want to lose weight, they will come to a dietitian. Okay, that's the most common thing. Or if they have a diabetic problem or they have some heart problem. But for young children, many parents may not feel the need to come to a dietitian, and your specialization is into the fields of pediatric. So what should be the scenarios, or what should be some red flags where the parents should definitely come to a dietitian or a nutritionist and connect? So what could you just list out a few of them?
So first, I would like to pinpoint that every parent, I'm sure, goes to a pediatrician. Is there any red flag for them to go to a pediatrician, or it's just a general checkup? So the first answer is you get your child to a pediatric nutritionist, even though you don't have any problem, for a general checkup, the way you go to a pediatrician, because the pediatrician is going to monitor the physiological changes in the child's growth and development. But a pediatric dietitian is actually going to look into the growth and development, the development of each and every organ, and so that you ensure prevention of any lifestyle diseases going to be coming in the future. So ideally, you should not have any reason to go to a dietitian. Just a normal follow up, just understanding if you're choosing the right path is enough for you to go to a dietitian or a pediatric nutritionist. But definitely, this scenario is not so common in India. So certain things which I can pinpoint first is growth and development according to the age. So if the child is not growing and developing with height and weight according to the age, that's first sign to visit a dietitian or a pediatrician. Second thing is, if the child, you have been introducing any food, and for the longest time the child is not accepting that food, then you need to get to a dietitian or a pediatrician or a pediatric nutritionist, so that introduction of that food is much earlier than the child growing and then not accepting at the age where they're going to school, and then you have less control over your child. And definitely certain other signs could be, if you see certain symptoms on your body, like I have seen children having some blackish discoloration on their neck. May not be in the first 5 years, but after 5 years, those are signs of insulin resistance. So certain different patches, if you see on your skin, is also one of the sign of visiting a dietitian. And certain nutritional deficiencies you might just understand by hair loss, by difference in the skin, by brittle nails. So those are certain signs telling you that the body is asking for certain nutrients which you are not aware of, and that calls for visiting a pediatrician, dietitian.
Thank you so much. What you really said was true, that it's very, very common for every parent to visit a pediatrician, but not so common to visit a dietitian or a nutritionist or a pediatric specialist. So very, very true. And we need to create a lot of awareness regarding this because it's very important, you know. So for this, so there were a lot of wonderful tips which you have shared with us today, Dr. Ria. It was really a pleasure having you over. I would also like to tell everybody that Dr. Ria is also available on Instagram as nutritionist.riyadedia, and she's also available on YouTube and Facebook. And she's a practicing dietitian at Mumbai. So the details are also available there. So if you would want to consult her, you can please connect with her on those social media platforms. And it was really a pleasure having you. And we at Little Amigo Nest will look forward to having more such interesting sessions with you, where we talk to you about more things which are concerning young children, because we have a lot of our followers as young mothers who are very new to parenting, and they don't know anything about it. So what you are sharing with your wisdom and experience has really helped today. So thank you, Dr. Ria. Thank you so much for coming over and sparing time. So it was really a pleasure having you.
Thank you for having me. It's my pleasure to be here. Thanks to Shruti, Nikita, and the entire team for having me on board. It was great to converse with you, interact with you on simple topics, but a greater impact which we are going to be creating in that side.